Hello, 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 YouTube world. How are you today? Technical difficulties going on? All right, good morning. How is everybody? So glad you guys were able to join. Welcome to our twice a month live CNA practice test game show where you guys get to answer potential test questions and compete for real prizes. And I'm so happy to have you with us today. So, those of you who are here, if you can just give me a quick hi in the chat and let me know if everything is coming through, if you can hear me, if everything is good. Good morning, Mama Chi-Chi. Hello, Micheline. Hi, Amelia. Hi, guys. Good morning. Hi. Hi, Michelle. Hi, Gianna. Hi, Felicia. Hi, guys. Okay, so we got quite a few people on. So let's talk about, good morning. Hi, guys. So let's talk a little bit about today's game show. Jean, I passed my exam. Thank you. Oh, congratulations. I'm so proud of you. Micheline passed both exams. Congratulations. And Joseph passed both of the tests on Thursday. Congratulations to you too. You guys are doing fantastic work out there. I am super, super proud of you all. Congratulations. So let's get into today's game show, and today is going to be on the biggest section of the test. This is section 4. It's basic nursing care provided by the nurse aide. So roughly a quarter of the questions on the written test are going to come from this category. So, thank you. Thank you. Oh, Felicia got yours on the 12th. Congratulations to you as well. Great job. Thank you. And thank you so much, Mama Chi-Chi. I do appreciate that. Okay, so this is the biggest section on the written exam. Lots of questions. And it's a pretty big section itself. A lot of topics are covered in this section, so it's going to have the most questions and the widest category of questions. So I could write 1,000 questions in this category easily because there's so much content here. But I picked out 15 that are going to cover kind of a wide variety, kind of a brief general overview of the types of topics that'll be covered in this particular section. So this is going to cover routine, chronic, non-life-threatening. So this is where you're going to get into your disease-focused types of questions. And it really centers on observation and reporting. So being able to recognize something is different, wrong, strange, weird, not right, and reporting that to the nurse without making decisions yourself. And sometimes it's a little bit difficult. And then we get into emergency processes. So before we answer these questions, I'm going to give you a couple of hints. And if you listen to what I'm saying, you're going to get them all right, okay? But this is really, really, really good information for you to have going into the test. So number 1, for routine tasks, okay? So feeding, dressing, grooming, caring for patients with long-term conditions like congestive heart failure or diabetes or after a stroke, right? Long-term, baseline, normal, non-emergency. CNAs do not make decisions. You do not act. You observe and report. Anything beyond that is not the right answer. Observe and report. Now, when we get into emergency situations, that changes. That changes because emergencies require immediate action right now. So CNAs have to act. So routine, CNAs observe and report, no implementation on their own. Emergencies, CNAs have to recognize that it's an emergency and act. So those are handled two totally separate ways. But if you notice, in this category, those things are together in that category. So what this means is some of the answers on the state exam, now mine are going to be written way easier, okay? But some of the answers on the state exam are going to ask you, right? One of the answers may be indicating that you perform an action rather than observe and report on a non-emergency situation. Okay, so if it's non-emergency, CNAs don't act, they observe and report and wait for direction. In an emergency, CNAs don't observe and report, they act. So it's important that you understand that those two things are handled completely differently. So when you're reading a question, the first thing you need to figure out is this an emergency? Okay, so that's going to be your very first question when it comes to questions from this particular category. Okay, all right, so let's talk prizes. Let me see here. Jean is working in a nursing home. Congratulations. Blue says, how about you do something in home care? It's getting so popular out here. I can't hire enough people willing to work in home care fast enough. Blue, I'm actually, believe it or not, working on a home health aid program. And it's going to be in conjunction with a platform that we partnered with called CaresLink. I'm working on a ton of content for home health aid, so stay tuned. Those questions will be coming up. Let's see here. Yes, emergency preparedness is such a hard section. Yes. Okay, so Kirsten's waiting to get the test date. How exciting. All right, so let's talk about prizes. So first place, you're going to get a T-shirt. You got a couple choices here. You can get our class shirt, which is what we call our cheat shirt. Become Inspire Care, which is what I'm wearing here. Call to Care, which is a pink heart shirt, and CNA Care Crew. So you're going to get one of those. You get to choose which one you want. If you come in first at the end of the game show, I'll give you the email. You're going to email me your name, your screen name, your address, and which shirt you want. So kind of pick out which one you're looking for there. Second place is going to get the card game. And our card game is super fun to play. It's here, CNA Principles card game. Super fun to play. It goes over all of the principles that you need to know to be successful, not just on the test, but when you're caring for patients. It answers all of your what-if questions. And you can play it with non-medical people because they can just use the colors and the numbers on the game to play effectively. So it's a great study tool as well as just a fun introduction to healthcare, and hopefully you can recruit some people to come in. Third place prize is going to be the badge holder and some motivational gifts. So you get some motivational, thank you very much for what you do gifts. Okay, so here are our rules. Each question is going to be displayed on the screen for 60 seconds. I will read the question and the answer choices to you. You're going to put into the chat a number, nothing else, just a number. 1, 2, 3, or 4, and then hit send. So whichever choice you want to make, hit send. YouTube will receive those entries, those comments, in a specific order. Now, our program grades on the order they're received into YouTube, which might look a little different than what you see on your screen. Remember, your responses are immediately, they show up right away. Going to YouTube takes a microsecond, so those comments will show up in an order on YouTube based on how they're received. At the end of the game, all the points will be added up and we will send out prizes to the top 3. Now, prizes only go to the United States. I'm not set up to ship internationally right now. It's just like a nightmare out there with all of the new regulations. So, Hind, oh, hi, nice to meet you. Okay, so question will be read to you. Pick an answer, 1, 2, or 3, or 4. Hit send. Don't put anything else. It can only read the numbers, 1, 2, 3, or 4. If you change your mind, it's not going to read your second option. It'll only take the first one. All right, are we ready? 15 questions. 15 questions. So let me get this started. You got about 30 seconds to get all limbered up. Get those fingers limbered. Make sure you're in a quiet environment. You can hear and see. And remember, you're competing for real prizes. Let me get a drink before we get started. All right. And 5 seconds to go. First question. A resident suddenly begins refusing meals and avoids eye contact. What should the CNA do first? 1. Report the behavior to the nurse. 2. Order supplement shakes. 3. Notify his family. Or 4. Withhold snacks until his appetite returns. So a resident suddenly begins refusing meals and avoids eye contact. What should the CNA do first? 1. Report the behavior to the nurse. 2. Order supplement shakes. 3. Notify his family. Or 4. Withhold snacks until his appetite returns. Go ahead and lock in your final answer. You've got about 10 seconds left. Now remember what I said earlier. I told you exactly how to answer this question. All right, the right answer here is number 1. Report the behavior to the nurse. Now this is important. I don't know what happened to my background graphic there. This is important. This is a non-emergency. Remember, in non-emergency processes, we don't take action. We don't make decisions. We don't change anything. We notice that it's a change in the patient and we report that to the nurse. And the nurse is going to tell us what to do from that point. Ordering supplement shakes, that's a nursing function, not ours. Notifying his family, a nursing function, not ours. Withhold snacks until his appetite improves, a nursing decision, not ours. So great job. Let's see how we did. Josh Knows Best came in first, followed by Bisla, Blue, and Micheline. Good job, guys. Question 2. When caring for a resident with chronic arthritis, the CNA should 1. Massage the joints firmly to relieve stiffness. 2. Keep the joints immobilized to prevent pain. 3. Assist with range of motion exercises as ordered. Or 4. Ignore complaints since the pain is ongoing. So what do you guys think? When caring for a resident with chronic arthritis, the CNA should 1. Massage the joints firmly to relieve stiffness. 2. Keep the joints immobilized to prevent pain. 3. Assist with range of motion exercises as ordered. Or 4. Ignore complaints since the pain is ongoing. Got about 10 seconds left. Go ahead and lock in your final answer. Got a couple different answers on the board. Let's take a look. The right answer here is to assist with range of motion exercises as ordered. Those are those 2 words that are super important. Massaging the joints, that's not a decision you can make. You are not allowed to implement an action that is not ordered. Keeping the joints immobilized, this can actually do more harm to the patient. We don't want the joints immobilized. We actually need gentle exercise. But again, it doesn't tell us that that immobilization was ordered. Ignore complaints. We never ignore complaints. That's just mean. You don't want to ignore complaints of pain. But assisting with range of motion exercises as ordered is the right answer. Bisla came in first, followed by Josh Knows Best, Atakumbi, and Gypsy, I think. Number 3. Which change should the CNA report immediately? 1. Resident slept an extra hour today. 2. Resident skipped dessert at lunch. 3. Resident asked for more water. Or 4. Resident is more confused than normal. What do you guys think? Which change should the CNA report immediately? 1. Resident slept an extra hour today. 2. Resident skipped dessert at lunch. 3. Resident asked for more water. Or 4. Resident is more confused than usual. Go ahead and lock in your final answer. You've got about 10 seconds left. What do you guys think? Which one has to be reported immediately? So the right answer here is resident is more confused than usual. Now, they all need to be reported, okay? Because anything we know, the nurse needs to know. A resident sleeping an extra hour, yeah, we all do that occasionally. That doesn't really indicate that something is going wrong with the patient. Resident skip dessert at lunch. Yeah, we all do that occasionally. It's just not really what we're looking for today. Resident asks for more water. Well, we all get thirsty. But a resident who's more confused than usual, there's those two key words there, than usual. That means it's a change for the patient, and all changes need to be reported. So we want to pay attention for those key words. Good. All right, how do we do? Bisla came in first, followed by Darvencia, Michelle, and Kirsten. Good job, guys. Very good job. All right, question 4. A diabetic resident complains of feeling dizzy and shaky. What is the CNA's best response? 1, assist them to bed and leave them to rest. 2, notify the nurse. 3, encourage a brisk walk to improve circulation. Or 4, offer juice and a snack. So a diabetic resident complains of feeling dizzy and shaky. What is the CNA's best response? 1, assist the resident to bed and leave them to rest. 2, notify the nurse. 3, encourage a brisk walk to improve circulation. Or 4, offer juice and a snack. How do we want to handle this? Go ahead and lock in your final answer. You got about 10 seconds left. You guys are doing fantastic. You're getting it. Good job. Good job. All right, the right answer here is number 2. Absolutely. And this is so important, guys. Remember that we can't implement action unless it's on the care plan or the nurse has told us to do it. So assisting the resident to bed and leaving them to rest, that does not address the problem. Encouraging a brisk walk to improve circulation, that's an action. We're not entitled to take action. We're not empowered to take action. Offering a juice and a snack, that's an action. It's not on the care plan for us to do that. So notify the nurse is the right answer here. Anything we know, they need to know. And a diabetic patient that's having symptoms, it could be high blood sugar. It could also be low blood sugar. We've got to check to figure out which is which. Josh Knows Best came in first, followed by Bisla, Darvencia, and Michelle. Good job. Question 5. When monitoring a resident with heart failure, the CNA should observe for 1, cold hands. 2, increased appetite. 3, swollen feet and ankles. Or 4, yellowing of the eyes. So when monitoring a resident with heart failure, the CNA should observe for 1, cold hands. 2, increased appetite. 3, swollen feet and ankles. Or 4, yellowing of the eyes. What do we want to monitor for with heart failure? Got about 15 seconds left. Go ahead and lock in your final answer. And remember, this is going to have to do with understanding some chronic conditions and what we should be looking for. This should be part of your CNA training program. All right, the right answer here is number 3, swollen feet and ankles. Yeah, super important, guys, because when the patient starts to fill up with fluid, we're going to see it usually in the lowest part of the body first because of gravity. Gravity pulls all that fluid down. So we end up with swollen feet and swollen ankles, and that tells us the heart really isn't pumping as hard as it should, and it will let us know pretty quickly that there's going to be a problem very shortly if we don't intervene. So if you miss this, if you don't report this to the nurse, the patient may end up in respiratory distress in a very short period of time. So always report your observations. Very good. Bisla came in first, followed by Helen, Michelle, and Micheline. Good job, guys. Very good. Question number 6. A resident begins coughing and sneezing frequently. The CNA should, 1, notify the nurse. 2, offer allergy medicine. 3, implement full PPE protocol. Or 4, thicken all liquids to prevent aspiration. So a resident begins coughing and sneezing frequently. The CNA should, 1, notify the nurse. 2, offer allergy medicine. 3, implement full PPE protocol. Or 4, thicken all liquids to prevent aspiration. How do you want to handle this? A resident begins coughing and sneezing frequently. What do we want to do? 10 seconds left. What do you guys think? How should we handle this? The right answer is number 1, notify the nurse. Absolutely. Most of you guys got this one right. Good job. Remember, anything we know, the nurse needs to know. They're coughing and sneezing frequently. The nurse has to assess and handle that. We don't offer allergy medicine, not our scope of practice. Implementing full PPE protocol, there's probably no need for that. But again, that's not something you can do as a CNA. You don't get to make that decision. The nurse has to assess the patient and figure out the next course of action. Thicken all liquids, that's an action. We're not allowed to take action that is not on the care plan. So we're not going to do that. We're going to notify the nurse and let the nurse make those decisions based on the needs of that particular patient. Good job. Josh Knows Best came in first, followed by Michelle, Kirsten, and Adekunbi. Good job. Question number 7. What is the best way to prevent pressure sores in a bed-bound resident? 1, keep the skin dry and reposition every 2 hours. 2, rub red areas vigorously to improve circulation. 3, use pillows under the knees to reduce pressure. Or 4, keep the top sheet tucked tightly along the sides of the bed. Go ahead and lock in your final answer. What is the best way to prevent pressure sores in a bed-bound resident? 1, keep the skin dry and reposition every 2 hours. 2, rub red areas vigorously to improve circulation. 3, use pillows under the knees to reduce pressure. Or 4, keep the top sheet tucked tightly along the sides of the bed. All right, go ahead and lock in your final answer. Yeah, keeping the skin dry and repositioning every 2 hours is what we are trained to do. That's what CNAs are going to do. Rubbing areas vigorously, not an approved action unless you're specifically told to do so by the nurse. That's not really how we should be handling it. Keeping pillows under the knees to reduce pressure, again, might be a good idea, but only when you have been assigned to do so. And keeping the top sheet tucked tightly along the sides of the bed, guys, that's going to restrict movement. It's going to promote immobilization, which can further irritate bed sores. So, Micheline, I'm so sorry. It's the way that YouTube receives the answers, which might be different than what you see on your screen. Bisla came in first, followed by Michelle, Josh Knows Best, and Micheline. All right, halfway point, guys, number 8. Which observation should be reported immediately due to possible dehydration? 1, pain on urination. 2, decreased thirst. 3, puffy face and hands. Or 4, dark concentrated urine. So which observation should be reported immediately due to possible dehydration? Now I'm going to tell you all of these should be reported immediately, but the last part of this sentence is what's important, due to possible dehydration. So what is a sign of possible dehydration? 1, pain and urination. 2, decreased thirst. 3, puffy face and hands. Or 4, dark concentrated urine. So go ahead and lock in your final answer. The right answer here is dark concentrated urine. That is a sign of dehydration. Pain on urination, that's a sign of a UTI, urinary tract infection. Dehydration usually doesn't produce pain on urination. Decreased thirst, that's probably what got us to dehydration, and decreased thirst is very common among the elderly. Puffy face and hands, that is not a sign of dehydration. That's actually a sign of fluid overload. All of these need to be reported to the nurse, absolutely. But what they're asking is, do you know what a sign of dehydration is and how to recognize it so we know what to report to the nurse? So that's the way these types of questions might be presented to you. So Bisla came in first, followed by Josh Knows Best, Micheline, and D. Jennifer. Good job. Question number 9. To ensure appropriate tracking when weighing a patient daily, the CNA should 1. Use a different scale each day. 2. Weigh the resident after a meal. 3. Weigh at the same time each day. Or 4. Record the weight only if it's changed. So to ensure appropriate tracking when weighing a patient daily, the CNA should 1. Use a different scale each day. 2. Weigh the resident after a meal. 3. Weigh at the same time each day. Or 4. Record the weight only if it's changed. Oh, sorry, Hen. All right, so how should we make sure that our daily weights are accurate? What is the right technique to use here? The right answer here is number 3, weigh at the same time each day. This is super important, guys, super important, because your weight fluctuates every day. It fluctuates based on what you ate the day before, how much sleep you got, your stress level, and cortisol production is going to affect this. I mean, it is affected by so many different things, but weighing at the same time each day helps provide some consistency there so we can figure out whether that weight change is due to disease process or just the natural fluctuations of aging or daily daily maintenance. Don't use a different scale, same scale. Don't weigh them after a meal, not a good idea. And don't record the weight only if it's changed. Record it every time you take it. Josh Knows Best came in first, followed by Bisla, Michelle, and Gianna. Good job. Question number 10. A resident with a recent stroke becomes withdrawn and tearful. The CNA should 1. Offer emotional support and notify the nurse. 2. Let the resident cry in private. 3. Ignore it. This is expected behavior. And 4. Call the family immediately. So a resident with a recent stroke becomes withdrawn and tearful. The CNA should 1. Offer emotional support and notify the nurse. 2. Let the resident cry in private. 3. Ignore it. This is expected behavior. Or 4, call the family immediately. How do we want to handle this? Guys, this is way more common than you would think. Emotional lability, or I guess a kind of a lay person's term would be mood swings, but just your mood goes up and down quite frequently. It's very common after a stroke. So yeah, we're going to offer emotional support, and we're definitely going to let the nurse know, because everything we know, the nurse should know. Don't let them cry in private. That's so sad. If somebody's having a hard time adjusting, we don't want to isolate them. Be with them. Offer them some emotional support. People don't need to feel alone when they feel alone. Don't ignore it. Yes, it might be expected behavior, but it still needs to be reported. And we don't call the family. That's not our role. That is the nurse's role if it's warranted. So we want to offer emotional support. And remember, this is way more common than you think it's going to be. Yeah, very common. So Michelle came in first, followed by Bisla, Josh Knows Best, and Adekunbi. Number 11. What is the first action the CNA should take if a resident starts choking and cannot speak? 1. Encourage them to cough. 2. Start back blows. 3. Give water. Or 4. Begin abdominal thrusts. What is the first action a CNA should take if a resident starts choking and cannot speak? Oh, those are key words there, guys. Cannot speak. 1. Encourage them to cough. 2. Start back blows. 3, give water, or 4, begin abdominal thrusts. How do we want to handle this? First thing you have to ask yourself is this an emergency? If it's an emergency, we have to act. If it's not an emergency, we're going to maintain the safety of the patient and notify the nurse. So which is this? The right answer here is number 4. This is an emergency. If they cannot speak, they cannot breathe. So this is a total occlusion. Encouraging them to cough, they can't. This is totally occluded. There is no air there to force up from the patient point of view. Coughing is not going to affect this. The food is down past that point. Starting back blows, that's not how we handle choking in adults. Giving water, you can actually cause this sequence of events to get way, way worse if you get water. Don't do that. What we want to do is begin abdominal thrusts to relieve the occlusion. It's an emergency, and that requires immediate action. Okay, Michelle came in first, followed by D. Jennifer, Gianna, and Micheline. All right, question number 12. A resident is found unconscious on the floor. What should the CNA do first? Attempt to move them to the bed. Assess for breathing and call for help. 3, check their pulse for 2 minutes. Or 4, call their family. So a resident is found unconscious on the floor. What should the CNA do first? 1, attempt to move them to the bed. 2, assess breathing and call for help. 3, check their pulse for 2 minutes. Or 4, call their family. How do we want to handle this? What do we do if we find somebody unconscious on the floor? Go ahead and lock in your final answer. You've got about 5 seconds left. Yeah, you guys are doing great. Good job. The right answer here is assess for breathing and call for help. So I'm going to give you kind of a really short lesson here. This is a lesson I want to do in one of my programs, but we have the alphabet, right? All 26 letters of the alphabet. Well, CNAs do ABC, airway, breathing, and circulation. We handle emergencies that are based on airway, breathing, and circulation. So if the patient is unconscious on the floor, we got to find out if they're breathing. If they're choking, we've got to help them with their airway. If their heart isn't pumping, we're going to do some compression. So ABCs are what CNAs do. Nurses and doctors, they do the rest of the alphabet, but we stay in our ABCs. So Michelle Jeffrey came in first on that one, followed by Josh Knows Best, Bisla, and Gypsy. Good job. All right, number 13. During lunch, a resident suddenly becomes pale and sweaty. The CNA should, 1, offer dessert to help raise their blood sugar. 2, notify the nurse immediately. 3, wait and see if the color returns. Or 4, encourage them to drink more water. So during lunch, a resident suddenly becomes pale and sweaty. How should we handle this? Should we, 1, offer dessert to help raise their blood sugar? Number 2, notify the nurse immediately. Number 3, wait and see if the color returns. Or number 4, encourage them to drink more water. How do you want to handle this? How do you want to handle this? We've got about 5 seconds left. Go ahead and lock in your final answer. The right answer here is notify the nurse immediately. Okay, they're breathing. So this isn't an emergency, but it is urgent. So remember, emergencies are the only times we can take action without direction. So here, your patient is breathing, they're pale and sweaty, something's going wrong, we know something's going wrong, but it's not an emergency yet. So we have to take direction from the nurse. So we're going to notify that nurse immediately. Don't wait until after lunch, or you may have an emergency on your hand. We don't want that. So identify symptoms early, report them promptly, and we can avoid emergencies. All right, good job. Josh Knows Best came in first, followed by Michelle, Bisla, and Gianna. I'm not sure if I'm saying that right. I'm sorry. Number 14. A resident grabs their chest and says, "I can't breathe." The CNA should, 1, help them sit upright and call for the nurse. 2, offer orange juice. 3, encourage deep breathing exercises. Or 4, take them for a walk. How do you want to handle this, guys? A resident grabs their chest and says, "I can't breathe." The CNA should, number 1, help them sit upright and call for the nurse. 2, offer orange juice. 3, encourage deep breathing exercises. Or 4, take them for a walk. How do you want to handle this? So a little hint here, if they are saying they can't breathe, that means they can breathe because they're able to talk. If you can't breathe, you can't talk. So they are breathing. They are breathing. Okay. What do we do for somebody who isn't breathing well? We help them sit up straight or even lean forward a little. That reduces the amount of pressure on the chest, allows the lungs to inflate a little bit better. So help them sit upright and call for the nurse is our answer here, because this is urgent but not emergency. The other 3 are actions, right? We don't take actions that aren't on the care plan. So offering orange juice, not us. Encouraging deep breathing exercises, not us. Taking them for a walk, not us. Those are not actions that have been cleared for us to do on the care plan. So if the resident grabs their chest and says, "I can't breathe," we need to notify the nurse, but help them sit up to help them breathe a little bit better. Josh Knows Best, followed by Bisla, Adekumbi, and Kirsten. Last question. A resident with a history of falls is found on the floor, but says, "I'm fine." The CNA should, 1, help them get back to bed. 2, leave to get the nurse. 3, let them get up slowly on their own. Or 4, stay with the resident and call for the nurse. So a resident with a history of falls is found on the floor but says, "I'm fine." The CNA should, 1, help them back to bed. 2, leave to go get the nurse. 3, let them get up slowly on their own. Or 4, stay with the resident and call for the nurse. How do we want to handle this? What is the right action to take here? All right. 10 seconds left. Go ahead and lock in your final answer. What do you guys think? What do you guys think? Yeah, number 4 is going to be right. Remember, everything we know, the nurse has to know. We don't take action until we're told to take action. So helping them back to bed? Nope, don't do that. Leave them to go get the nurse. Never leave somebody alone that's just fallen. And let them get up slowly on their own? No. And the reason for this is that a lot of times during a fall, we have an adrenaline dump, which means that we may have a broken hip and we don't know it. We can't feel it yet because that adrenaline has us all keyed up, fight or flight response. So we don't let the patient up. We get the nurse to assess the patient, and then the nurse will make that decision along with input from the patient. We stay with the resident, never leave an emergency patient alone. We stay with them and get somebody to go get the nurse. Josh Knows Best came in first, followed by Michelle, Bisla, and Kirsten. This is a close one, guys. First place, T-Shirt, Josh Knows Best. Second place, card game, is Bisla. And third place, motivational gifts, is Michelle Jeffrey. You guys did fantastic. I am so proud of all of you. All of you. You did great. I hope you learned a few things in this, how to answer those tricky questions. First thing that you need to do is find out, is this an emergency, a real emergency? Is their airway affected? Is their breathing stopped? Or has their heart stopped? True emergencies require action on our part. If one of those 3 if it's not an emergency, if those 3 things are still okay, then we stay with the patient and notify the nurse, okay? Don't take action without an emergency. Very important, because the action you take may actually make the situation worse. We need that nurse's knowledge to know what our next step is. So, those of you who won, I need you to send me an email to foryourcna@gmail.com. First place, you're going to get a t-shirt. So let me go back over here and show you those t-shirts. So first place, you can have the Become Inspire Care shirt, the CNA Care Crew shirt, the cheat shirt that has all of my principles in those words, or the pink heart shirt. So you get to choose. So all three of you, I need you to send me your screen name, your real name, your mailing address, and for first place, Josh knows best, let me know what type of t-shirt and what size. All right, so if you guys like this, if this helped you at all understand how the test is formulated, how to pick the right answer, even if you may not understand the question itself, how to choose the right answer, look for those keywords. Look to see, is it an emergency? Make sure that the answer that you're choosing is on the care plan or the approved action for an emergency. And make sure you look at all of the choices before you make your decision, because the one you think is right may not be the best choice. There may be one a little bit further down that's a better choice. So look at all of the options before you make that decision. So if you like this, give it a thumbs up on YouTube. That lets YouTube know that you guys find this content valuable, and it helps us continue to produce this type of content for you and give you prizes, and maybe come up with some new prizes moving forward. But I need some help from you guys on this. Blue, no, actually they're not better behaved this week. I gave both of them baths yesterday, and they rewarded me by chewing up a whole bunch of things because they were not very pleased with the bath time process. So no, they are not any better behaved this week. You should see, Jet eats sheets and pillows, eats them. Doesn't just chew them, he eats them. And he has destroyed almost every pillow in my house. It's crazy. But I still love them to pieces. I still love them to pieces. All right, guys, I'm going to go ahead and sign off. I am creating a whole home health aid program from scratch. Lots of lessons. I'm doing a lot of graphic work for it. So stay tuned for that. You'll see some lessons popping up here and there on our YouTube channel. So if you haven't subscribed, please feel free to do so. Until next time, guys. Oh, class starts again on Monday. So if you have a chance, join our classroom live stream. You can do it right here on YouTube. If you press the subscribe and ring the bell, YouTube will actually let you know when we go live. But we have another class session starting on Monday at 9 a.m. Eastern, and I hope to see you there. Until next time, guys, happy caregiving. Bye.